Welcome to the on-demand workshop, Maternal Mental Health, Tools for Assessing Depression During and After Pregnancy. My name is Zainab Azim, and today we will be examining the efficacy of screening for depression and the reliability of screening tools. This is an important topic that needs to be discussed to improve the detection of depression as it relates to maternal mental health. The learning objectives of this on-demand workshop are discussed on this slide. 1. To increase awareness about the prevalence and impact of depression on pregnant and postpartum women. 2. To recognize the benefits of early screening to improve maternal mental well-being. 3. To improve knowledge of the administration, scoring, and interpretation of the EPDS and PHQ-9 depression screening tools. And 4. To enhance familiarity with appropriate referral processes and evidence-based treatment resources. This on-demand workshop will provide an overview of the important points relating to maternal depression, an introduction of the EPDS and PHQ-9 depression screening tools, followed by an interactive opportunity highlighting 2 case studies, which will include interpreting and scoring the EPDS and PHQ-9 depression screening assessments. First of all, healthcare professionals need to be aware of the prevalence and impact of depression on pregnant and postpartum women. Perinatal depression is estimated to affect 7 to 15% of pregnant women, but early depression screening during the prenatal period is not mandated, as many healthcare providers do not routinely screen their patients, which can lead to undiagnosed and untreated prenatal and postpartum depression. Depression rates during pregnancy have been reported to be as high as 7.4% in the first trimester, 12 to 12.8% in the second and third trimesters, and 15% in the first year after delivery, which is the postpartum period. There are 2 common tools used for depression screening during pregnancy and postpartum period. These are the Edinburgh Postnatal Depression Scale, which is also known as the EPDS, and the Patient Health Questionnaire 9, which is also known as the PHQ-9. This discussion of the prevalence and impact of depression on pregnant and postpartum women is very important because it is so widespread. Positive scores on the EPDS, which are greater than or equal to 13, are more predominant in the prenatal stage, thus underscoring the importance of an effective follow-up regimen to improve the mental health outcomes of mothers. OBGYNs and obstetric caregivers need to screen and ask questions related to depression and mood disorders early on during the pregnancy to improve depressive symptoms during postpartum. Findings indicate that obstetric providers should screen for depression as early in the pregnancy as possible and continue to screen as often regardless of previous negative EPDS scores. Implementing routine screening in the prenatal and postnatal stages increases identification of depressive symptoms and enables earlier diagnosis of depression. The benefits of early screening are significant and are listed on this slide. Early screening plays a critical role in improving the identification, diagnosis, and subsequent treatment of depression within the early prenatal and postpartum stages. Early depression screening results in lower rates of positive scores and improves early detection of depression when screening is conducted during the prenatal stage compared to screening during postpartum only or not at all. These next 2 slides show a comparison between screening and no screening. Benefits of screening. Toombs et al. 2016 identified the EPDS screening tool as an effective screening approach for improving the identification of individuals exhibiting depressive symptoms and would be effective in enhancing mental well-being. We will talk about the screening tools more in depth during the case study here shortly. Choi et al. 2022 found that depressive symptoms decreased over time from first trimester to 6 months postpartum from 18.6% to 19.6% during the prenatal period and 15.8% to 16.2% during the postpartum period. O'Connor et al. 2016 found 18% to 59% relative reduction in the risk of depression following the implementation of early screening. This provides evidence that the scores can decrease following early screening. This slide discusses the effects of no screening. No screening during the prenatal period means there would be no early detection for depression, and patients would not be able to obtain the necessary mental health treatment. This will lead to undiagnosed and untreated prenatal and postpartum depression. Premji et al. 2019 found in a study of 2,261 women, in which 84% of women received a low, moderate risk score for postpartum depression and 3% received a high risk score. 13% of those women were unscreened for depression. The unscreened women visited their physician for a postpartum related reason at a median of 50 days post delivery. These next few slides discuss the interpretation, administration, and the scoring of the EPDS and PHQ-9 depression screening tools during the prenatal and postnatal stages. The EPDS and PHQ-9 are the most common screening tools. The Edinburgh Postnatal Depression Scale is the most common screening used during perinatal care. It is referred to as the legacy screener because it is a tool that is well validated and widely used. It is a 10-item self-reported depression screening tool. There are cutoff values that indicate if an individual may have depression. Cutoff values of greater than or equal to 13 are used to identify women who might have depression for the EPDS. The cutoff values indicate major depressive symptoms are likely present and further diagnostic assessment is required. The patient-held questionnaire 9 is an 9-item self-reported screening tool, which is an alternative to the EPDS. It is widely used for the general population along with pregnant and postpartum women. The scores for this screening range from 0 to 27 and are calculated by adding up the responses to the 9 questions. Cutoff values of greater than or equal to 10 are used to identify women who might have depression. We will now review how to score the EPDS. Please go ahead and scan the EPDS QR code to be taken to the assessment. A total score of greater than or equal to 13 out of 30 is considered a flag for the need to follow up on possible depressive symptoms. If the EPDS score is greater than or equal to 13, refer to an appropriate health professional, ideally the patient's general practitioner. In the postnatal period, arrange referral or ongoing care if score is greater than or equal to 13, in line with clinical judgment. We will go through the 10 questions here. For each question, there are 4 choices available to choose from. Each question has different choices. Question 1. I have been able to laugh and see the funny side of things. The responses to this question are 0, as much as I always could. 1, not quite so much now. 2, definitely not so much now. Or 3, not at all. 2, I have looked forward with enjoyment to things. The responses to this question are 0, as much as I ever did. 1, rather less than I used to. 2, definitely less than I used to. 3, hardly at all. Question 3. I have blamed myself unnecessarily when things went wrong. The responses to this question are 3, yes, most of the time. 2, yes, some of the time. 1, not very often. Or 0, no, never. Question 4. I have been anxious or worried for no good reason. The responses to this question are 0, no, not at all. 1, hardly ever. 2, yes, sometimes. Or 3, yes, very often. Question 5. I have felt scared or panicky for no very good reason. The responses to this question are 3, yes, quite a lot. 2, yes, sometimes. 1, no, not much. Or 0, no, not at all. 6. Things have been getting on top of me. The responses to this question are 3, yes, most of the time I haven't been able to cope at all. 2, yes, sometimes I haven't been coping as well as usual. 1, no, most of the time I have coped quite well. Or 0, no, I have been coping as well as ever. 7, I have been so unhappy that I have had difficulty sleeping. The responses to this question are 3, yes, most of the time. 2, yes, sometimes. 1, not very often. Or 0, no, not at all. Question 8. I have felt sad or miserable. The responses to this question are 3, yes, most of the time. 2, yes, quite often, 1, not very often, or 0, no, not at all. 9. I have been so unhappy that I have been crying. The responses to this question are 3, yes, most of the time, 2, yes, quite often, 1, only occasionally, or 0, no, never. And lastly, question 10. The thought of harming myself has occurred to me. The responses to this question are 3, yes, quite often, 2, sometimes, 1, hardly ever, or 0, never. To get the total score, you simply add the number for the responses picked. There is also an electronic version that automatically calculates the responses for you. This would be easier for you as professionals to use when working with patients in the clinical setting. To access the calculator, please scan the calculator QR code. We will now move on to our next screening assessment, the Patient Health Questionnaire 9. This is a 9-item screening assessment. Please scan the QR code to be directed to the assessment. There are 4 columns with responses of 0 to 3. 0 is not at all, 1 is several days, 2 is more than half the days, and 3 is nearly every day. We will go through the 9 questions here. Question 1. Little interest or pleasure in doing things. 2. Feeling down, depressed, or hopeless. 3. Trouble falling or staying asleep, or sleeping too much. 4. Feeling tired or having little energy. 5. Poor appetite or overeating. 6. Feeling bad about yourself or that you are a failure or have let yourself or your family down. 7. Trouble concentrating on things such as reading the newspaper or watching television. 8. Moving or speaking so slowly that other people could have noticed. Or the opposite, being so fidgety or restless that you have been moving around a lot more than usual. And lastly, question 9. Thoughts that you could be better off dead or are hurting yourself. This slide demonstrates how to score the PHQ-9 assessment. To get the final total, each answer is added together. 0 is not at all, 1 is several days, 2 is more than half the days, and 3 is nearly every day. Here is the table for what the scores indicate. Remember that greater than or equal to 10 indicates at risk. Scores of 1 to 4 is minimal depression, 5 to 9 is mild depression, 10 to 14 is moderate depression, 15 to 19 is moderately severe depression, and scores of 20 to 27 is severe depression. As you can see here, for initial diagnosis, if there are at least 4 checks in the shaded section of the assessment, including questions 1 and 2, consider a depressive disorder. To consider for major depressive disorder, if there are at least 5 checks in the shaded section, one of which corresponds to questions 1 or 2. And to consider for other depressive disorders, if there are 2 to 4 checks in the shaded section, one of which corresponds to questions 1 and 2. We will conclude the findings with referral processes and evidence-based treatment resources. Mild, moderate, or severe depression will determine the various treatment options for the patients. If patients score above the cutoff values on the screening assessment, then appropriate referral processes and evidence-based treatment resources need to be considered. These would be greater than or equal to 13 on the EPDS and greater than or equal to 10 on the PHQ-9. Referrals should be made to mental health providers who specialize in diagnosing and treating mental disorders if scores are above the cutoff values at any point during pregnancy and postpartum stage. These providers include psychologists, psychiatrists, and social workers. Health professionals should continue administering repeated screening throughout the prenatal and postpartum period. In addition, appropriate antidepressant medications should be prescribed as necessary. Other treatment options are psychotherapy and psychological interventions. This concludes our on-demand workshop. I appreciate your time. If you could please take a minute to complete this survey, your feedback is appreciated. The questions included in the surveys will help determine what the healthcare professionals learned and what changes they will implement in their clinical practice. This will also help in providing feedback regarding how well goals were achieved and what could be done to improve the workshop in the future. You can scan the QR code to be taken to SurveyMonkey. Thank you.